We have a lot of expertise right here in Georgia and around the world. People understand that what the world has as a health problem, we have as a health problem. When you have devastating disease around the world, it's going to affect the world economy. It's going to be a drain on everybody, including ourselves. We can't just ignore it.
Congressman Rich McCormick. He serves on the House Foreign Affairs Committee, where he has been a tireless advocate for strategic U.S. engagement in the world. And prior to Congress, he served in the U.S. Marine Corps and the U.S. Navy for over 20 years.
Just tell us a little bit about what you think we need to do to make sure that Georgia wins, as we win as a country, in addressing international assistance, foreign policy, and diplomacy.
We have to show the world we care because we are global leaders, and that benefits us immensely in our influence around the world. But isolationism is dangerous because isolationism never was and never will be the answer. So I think it's really important to make that case consistently, because it is in our best self-interest, because what you don't invest now, you'll have to invest 10 times in the future to stabilize the world.
He spoke about the U.S. engagement in global health as enlightened self-interest. As a practicing infectious disease physician, isolationism is not going to get us anywhere.
We are working 24/7 to try to control disease outbreaks. We also live in a city that has one of the busiest airport in the world, with 108 million travelers passing through it. We have fortunately been able to maintain our overseas presence in 63 countries with additional regional partnerships, and I think those are incredibly important so that we can control things and not wait for them to reach our shores.
And if you look at what Americans do, both here and around the world, it's unsurpassed. We are the most generous nation in the world's history. And I think if we continue to do this, we can solve a lot of problems, but we have to be smart. There's been a lot of controversy over the way we delivered aid in our government. So first off, accountability. Making sure that it's not politicized, making sure that it's delivered where it needs to be for the biggest bang for the buck. Being a recipient of education right here in Georgia, going to Morehouse School of Medicine, and then going to Emory for my residency in emergency medicine, seeing the research that's done in those universities and the advancement in technology and standards for all deliverable medicine is amazing. I was very, very fortunate to participate in that training, some of the best in the world. People from the CDC that actually cross-train with us and help our students better understand infectious disease and global challenges. When we address healthcare around the world, it comes back to a self-interest to some degree. We can do things that nobody's ever seen in the history of mankind when you combine the technologies and the wealth of our nation and do it right.